The best exercises to do with neck pain. Neck pain can be severely debilitating. It really affects us when we sleep, and also if you are in a desk-based job, then it can often be really tricky to actually sit there and concentrate when your neck is in pain. So I'm going to show you 4 simple exercises to get you out of neck pain quickly, and also these exercises can be used to stop you from getting pain in the long run. I'm Dr. Jeremy Andrews, Doctor of Chiropractic here at West Chiropractic in Surrey. So let's start by talking about why you get neck pain. Well, if you sit for too long, you're going to be more risk of having neck pain. The reason is we're not designed to be sitting for long periods of time. So you need to make sure that if you are sitting, shoulders are run back, chin is tucked in like this, and you're making the best out of your desk position. You can watch my working from home YouTube video we put out 2 weeks ago, and that will give you some really good insights into how to set up your desk setup. The other reason is if you had a trauma or an injury, so if you're playing sports like football, netball, rugby for example, and you've twisted your neck or landed awkwardly, that can often put pressure on the neck as well. We need to make sure that we're warming up correctly. If you have had an injury, that you're using proper rehab methods to get the neck in the best position and ensure it's not causing damage to the ligaments long run. Well, let's get into it, and we'll talk a little bit more about the neck afterwards as well. So these are my top 4 tips for ensuring that we can keep the neck in the best position. So first one, it's going to be very simple. It's going to be a lateral flexion stretch. So what do we mean by that? Well, lateral is to the side, and then you're flexing the neck over like this. So very gentle. Now it's really important that the shoulder on this side isn't hunched up like that. It's not going to stretch this muscle that runs all the way from the base of the skull into the shoulder and then down the back of the shoulder blade. It's a triangle muscle called the trapezius or upper trapezius, and it can go all the way around the back of the head, refer around there, and that can cause pain in your head also, or pain behind the back of the eye. That's very effective. We get this stretched out. Obviously do this on both sides, making sure this shoulder, drop it down. You can even pull the shoulder down like that, help stretch the shoulder blade. And if you're feeling really fancy, you can actually rotate the head to get different fibers. So just take it nice and gentle with that one. Back and forth like that. I would hold that for 30 seconds, try and do 3 times on each side. You don't want to yank the head over, so that's going to stretch too much of the nerves, you might get pins and needles. So just to that light tolerance where you're starting to feel a stretch, take it nice and easy. Forwards and backwards. So flexion like this, and extension like that. So this is going to help to floss the nerves, and it's going to help with the normal movement through the spine. Obviously we don't want to be in flexion for too long, that's not where our neck is designed, but it is going to help stretch the ligaments. And we do this 10 times. If you get any dizziness or blurred vision, just stop. You just want to take it nice and easy. Now, things you don't want to do are stretch like this or stretch like that and push over force into the neck. The neck is quite a fragile object. So just take it nice and gentle when you're doing those. Okay. Now, the other one is going to be number 3, rotation. So this is very easy again, but you need to make sure your shoulders are fixed. So really pulling the shoulder blades back, opening up the chest, turning from side to side. Very simply like this. And taking a lot of pressure off the neck. And again, you can use some, just hold at the end there, and then very gently through here. This allows the neck to get that rotational force through it, taking pressure off the jaw as well. You want to make sure your jaw is retracted. The jaw is linked in with the neck. If there's a lot of tension in the jaw, it can put pressure around the neck, and cause headaches as well. So if you're biting at night, you need to make sure that you're seeing your dentist who's familiar with putting mouth guards in. They can help with that jaw tension also. Okay, first 3, okay. 4th one, and probably the most important one, is the chin tuck. So I'll show you from the front. Chin tuck is this, so double chin. All of our clients ask us, do I get double chin with this? No, you won't. So like this, okay? Retraction, chin tuck retraction. From the side, okay? So like this, okay? Now, 10 times. Common mistakes would be to pull back like this and then go jut. We don't want that, okay? Don't jut the chin back. Simply come back to resting and then come back like this, okay? Other common mistakes would be lifting the head in extension or going back into flexion. It's neutral, chin tuck. Neutral, chin tuck like this, okay? So those would be the first 4 things that I would try. Really simple exercise you can do at your desk. Don't do them when you're driving, obviously, but you can sit at your desk and do those. Do them when you're relaxing in the evenings, before you go to bed. Often at night is where one of the biggest pressures we have on our neck is. To really ensure that we're not putting too much pressure on there by stretching it out before you get into bed. So the neck can cause headaches as well. And the reason is the neck refers pain around the back of the head. The nerves that come out the base here, they go into something called the suboccipital. So sub is below, occipital is eye, okay? I think it's a Latin term, I'm not sure. I'm not actually sure. Yeah, occiput is eye, so occipital, back of the head through here. All right, and there's muscles there that have a lot of nerve control, and those nerves run all the way around the head here. Could cause headaches, migraines, dizziness, blurred vision. It's really important we try and keep that neck in a good position and it's not pressing on those nerves. It can be severely debilitating when you're having migraines every few days and you've got to lock yourself away in a cold, dark room with no noise and no lights. So it's really important we keep that good. All right, so if you like the video, please hit the like button, subscribe to the channel as well, and don't forget you can grab a copy of my best-selling book here. This is the second edition, Transform Your Life. First one is Secret Cure to Back Pain. It's on Amazon. The link is down below. I've been Jeremy Andrews. Thank you so much.